agenda, but it's really packed today. So we'll get right into it. So our agenda is fiscal and leadership updates, a presentation about the ship, and we'll also be talking about some upcoming events that you all have and some announcements. And as always, time for questions. So we'll go ahead and get started. Um, next, all right, for leadership announcements, Dolly Jacilia, would you like to take it away?
Sure, I can take it away. Good morning, everybody. My name is Josiah Johnson. I'm one of the program managers here on the community engagement team. We are delighted to have you here today on this beautiful sunny day, at least in Portland. So a couple of announcements. The first thing is it is activity report, expenditure report season, y'all. So this would be it's opening up today. And this would be a chance for you to tell us what you've been up to and report on your expenses from January to March. We are releasing it today, so we extended the deadline to May 9th to give you enough time, like a full month, to be able to get those reports in. Everything can be accessed through your dashboard. As a reminder, your expenditure report is cumulative, so you just want to keep all of the previous quarters on the um, document that you submit in when you're submitting your quarter 12 expenses. Um, Next, the Public Health Equity Conference, y'all, we are in the, I
Cecilia, you got muted.
think there's a ghost. I didn't even touch my mouse. We are weeks away and we are really, really excited. I wanted to see if Dolly wanted to share any news, any updates about the conference with the team today.
Good morning, y'all. Good morning. Okay,
Morning.
y'all, when I tell you we have been working our butt off, we have been working our butt off. And my team doesn't even really know how close we came to not having this event. But I cried and I fought. And so you all better show up. Today is the last day to register. I'm going to drop the link in. Y'all, we are weeks away, April the 23rd. I am getting all of the emails. I approved our little photo booth design. We meet per diem with our menu. We've got captioning, we've got ASL. If you registered for needing interpretation, we got that request. Y'all, we have enough space left if there were other people in your organizations that wanted to attend that didn't yet register, please let me know. Okay? Today is the day. Send it to them right now. Right now. Because the registration is going to end soon. And I don't want to hear anybody say, oh, well, I didn't know about it. Because you did know about it. And this is going to be fun, y'all. We've got some really great things lined up for you. So I want you all to come. I want you to be hyped. And I want you to know that we have worked very hard for this event for you. So that's my 2 cents. Register. You got until 5 p.m. Hurry up. You can change your mind because I know people are going to change their mind, Melissa. FYI. Some of y'all are going to be like, "Oh, that World Cafe roundtable looks real good. I'm going to go in there." Or you're going to be like, "Oh, I really do need some acupuncture right now. I'm going to go ahead and take the acupuncture session this afternoon." I already know. I already know. Okay, I've taken enough time. Josiah, I'll hand it back to you. Oh, am I supposed to do the funding challenges? Ooh, okay. Jody, I don't know if we have any links or anything ready, but I'm going to tell you all what I know. And what I know is that Oregon was, like many other states, deeply impacted by the most recent round of funding cuts by the federal government, specifically the CDC. There was a number of grants which we had from the Centers for Disease Control that were um, we were told to stop on. And so some good news. Uh Oregon was like, nah. And we filed some litigation with a number of other suits against the federal government. And we got some really excellent news yesterday, which is that a judge has ordered, and it looks like Leanne dropped the link. Y'all, I don't know all the right legal things, but they were like, hold up, wait a minute. And there's 2 weeks before the next legal action. I'm not a lawyer. I will share what I know. Um, you can see the website that Jessica dropped. There is a federal changes website that was created. And if I'm being honest, it's where we're also going to get a lot of information. So as much as I know, I'm going to share with you. But what I do know is I feel very proud to live in a state or to work for a state that is willing to go to bat for our work. That's, I think, what I want you to know. So we're gonna all ride this train together. I think the important message for CBOs is y'all, I already spent that money for you. You all already spent that money. You did. So I've been very diligent. The money that was left was going to be for us to plan programming hopefully through June of 2026. So now we'll figure out some stuff. But I think hopefully this is enough information to get you going. Um, I appreciate you all and know that we're working hard on the back end and are deeply, deeply concerned and sending so much love and energy to our friends and colleagues at the federal level, who many of which have lost their jobs recently. So that's it.
Thank you, Dolly and Jacilia. We can move on to some fiscal updates with our wonderful fiscal crew.
Thanks, Allison. Hi, everyone. Zach Owens, he, him pronouns, resident fiscal dude supporting these efforts. Let's see, March payments. They should be hitting bank accounts this week. They should have either already hit or will be hitting early next week. Um, just so you all know, our focus this month is April payments, keep the money flowing. And then in addition to that, working on the award letters to communicate to you all the details and the numbers of the extension that we're offering from extending the contract through December 31st, 2025. And simultaneously, we're working on the contract amendments and doing all the legwork to make that happen. So, busy month, and we'll provide another update next FYI Friday about be a little more solid in when you can expect to see the award letters, and we'll talk about kind of what's going to be in there. The key thing to remember is that once we do send the letters, you will need to confirm acceptance of the award and say, yeah, we want your money, before we can then go ahead and send our contract amendments with you on for processing. So again, more to come. We will tell you what to look for, when to look for it, and we're working hard. So thank you. That's all I got.
Thanks, Zach. Any questions? All right. Shiloh, see your hand.
Good morning. My name is Shiloh West from the Arco-Lane County. I just missed the very first 5 minutes and I came in to seeing an extension, or not extension, but a date of May 5th for activity and expenditure reports. So it's not the 31st, it's May 5th.
It's May 9th. And
Or May 9th, I'm sorry.
if you want to turn it in, on the 31st, if you want to turn it in as soon as you open it today, that's fine. We just wanted to give you a
A
little bit
little
more time.
time. Okay,
Yeah.
wonderful. Thank you.
All
I'm
right.
sorry, I can't see my raise hand feature. This is Evelyn. I just wanted to make sure for clarification for our organization, and I may have to talk to my CEC, but there's been some confusion about one expenditure report and two expenditure reports that are due for a single contract. Can you clarify, Zach?
Yeah, I think so. So expenditure reports are due for each program element. So if you're funded through multiple program elements, you need to submit an expenditure report for each program element. I know the most common thing that's come up is that we've been trying to work through is there was I think some confusion when we added on that the 5007, the public health infrastructure grant funding, because that wasn't really its own program. It was more so just to supplement the work you're already doing for like tobacco or environmental public health or what have you. But for us, we do still need two expenditure reports because it's two program elements. And so we need to keep that straight and separate for our own reporting purposes. If that answers your question, great. If not, please ask more questions, or we could also take it offline.
We can take it offline. Thank you, Zach.
Cool.
And Evelyn, you're not the only one in that scenario. There are a few organizations who had only submitted one expense report for however many months, and then another program element was added when more funds were added. So definitely we can connect and make sure it's clear. Thank you.
So I think I just want to clarify a point that probably led to a lot of confusion. Hi everyone, this is Leanne. So when we gave additional money, the messaging was this is more money for your current project. So a lot of you are getting money from a different bucket source that was used to supplement a project or a program that you were already working in. Which, makes sense why it confused a lot of you because you're like, well, I'm working the same project for the one program. um it doesn't make sense. Why am I having to do two expense reports? Where the reason being was that we added monies from a different source essentially, but it was really to fund whatever project you were working on. And there was no expectation to shift or to add a project for that source. It was really just a supplement for everything that you were already doing. It's just where the money's coming from is different sources. And so I think that led to a lot of confusion because it's one project, but multiple funding sources. But again, if you need clarification, Zach is happy to take it offline or answer questions, or your CECs are also available to clarify.
Thanks, Leanne. I want to add one more piece to that. I understand for a lot of you, the timing might be weird. And it's like, well, we've been doing this for months. Why are you bringing it up now? And quite frankly, it's because we are totally overwhelmed, completely backlogged, and it's like the fires that rise to the top. So when something comes to our attention, those that's what we prioritize. I now have a full team, y'all. Two additional people and me. So that's great. And we're getting more on top of reviewing expenditure reports consistently and catching up on some of the reviews of things that you've submitted. Um, and I am not at all trying to belittle the importance of those documents. Like we need them to meet the contract administration requirements. And in a perfect world, we would be so in tune with every single one of them. But as it is, we've been doing a lot of spot checking. So for expenditure reports, we'll be like, okay, this quarter we're going to look at any ones that are showing like, oh wow, they're spending their money pretty fast. We'll check those. Or if we get one where someone reaches out and they have a question and we dig into it, then we provide those answers. So um, we want to get to a spot where we are able to thoroughly review everything every time it's submitted and give you um, feedback in a timely manner. But that just has not been possible. Um, we're getting there. But I did want to call that to attention because I am sure that is a question of like, well, what the heck? We've done this for 3 quarters. Why are you mentioning it now? And it's because it just didn't get caught. And we are trying to work through and correct things and tidy everything up as it comes. And that's that's the best I can explain there. So thanks.
One question in the chat from Leslie. Are activity reports required for public health infrastructure separately from the other funding areas?
No, so those of you who got public health infrastructure grants, again, they were meant to supplement the program that you were already working in. So some of you were working environmental public health or commercial tobacco. And when you got the additional public health infrastructure money, it was meant to just add on to the program that you were already doing. So we're not seeking separate activity reports because you weren't required to do a separate program or a separate work plan. It was all still whatever program or work plan you were already doing. But it does require separate expense reports because it is a different bucket of money. So while it doesn't require a different activity report because you're doing just one work plan, it does require separate expense reports because it's two different buckets of money.
Thanks for the clarification, Leanne and Zach. I am going to move us along because we do have a couple more things we need to try to cover today. But feel free to keep putting your questions in the chat and we will get to that when we are at the end of this FYI Friday. I'd like to introduce the wonderful Jamila Norton, who's going to talk with us a little bit about the State Health Improvement Plan or the SHIP. Jamila, take it away.
Thank you so much, Allison, and thank you all for inviting us into this space. So good to see many familiar names and some new names. Um, you could be anywhere in the world and you're here with us, and that's pretty great. I'm here today to talk about the state health improvement and most importantly, get y'all's input on what it looks like in the next iteration. Next slide, please. So Healthier Together Oregon. What are your health priorities? And um, this is part of our work in redeveloping the state health improvement plan. We are currently listening to community and going to different community spaces to share back a little bit about what we heard in the fall and gather input from y'all. Next slide. These slides, I do I do want to acknowledge, I'm going to move through some of this kind of quickly, but these slides are available as part of the materials that go out. And you're welcome to connect with me or any of my engagement team colleagues who are going to different spaces to hear from folks and connect with folks. By the way, I use she, her pronouns. Today, we're going to share back a little bit about what we heard from community in the fall and from y'all in the fall. I will share a little bit about what the ship is, and most importantly, hear from y'all about what you think our ship priorities should be. Feel free to ask questions as we go along or hold them towards the end. So in the fall, we went to 12 different community spaces, Dulce and I, to share a little bit about the work we were doing with the state health assessment. And we were here in October, actually, talking and hearing from you. Since then, we have worked with our steering committee to complete our state health assessment, and now we are shifting into our state health improvement plan. And I wanted to just come back with some updates. Next slide. Oh, very good. We can, so in the time since we talked, we reviewed feedback and we have created a potential list of SHIP priorities. And we have funded 10 partners to do some of the outreach and engagement work with us. Next slide. So here are some of the things we heard from y'all in the fall of 2024. Next slide. So we came and we asked the question, what does being healthy mean to you? And everybody was really clear that they considered health to be holistic, and that included components of physical, mental, emotional, financial, spiritual well-being, and getting all of those needs met in diverse ways. And special shout out to the importance of connecting socially and having needs met in accessible, responsive ways. Next slide. Folks really highlighted the importance of being connected personally with places, land, environment that is healthy and supports thriving where we are. And we talked a lot about access and how systems needed to be accessible to everyone and responsive to the needs of diverse people. Next slide. And yes, again, more information about access and how we really need to take a systems approach and think about the systems in place and the underpinnings of this work. Next slide. So today, we are here to get some information from you all. Yes, these materials will be shared, and if you have a space where you'd like me or Dulce to come and share this information and get input, happy to do that. So today, I'd really love to talk with you about the State Health Improvement Plan. The State Health Improvement Plan is a roadmap that outlines strategies to address our state's biggest health priorities. We take this document and this plan really seriously in the Public Health Division. It informs our policies, partnerships, and investments for OHA and other state agencies. And it does align with OHA's strategic plan. The Equity Office and the Community Engagement Team really were dreams and plans that aligned with the previous state health improvement plan, which is also known as Healthier Together Oregon. Next slide. So just a little bit of information about the SHIP. So in the SHIP, we have different components of the State Health Improvement Plan. First and foremost, we have the framing of the SHIP. And this is really where we're going to talk about our values. And we're going to talk about things like equity and access and institutional biases. And this is where I'm hoping to use some community voice to be real about the current landscape in which we're trying to do this work. Excuse me. Other components of the SHIP are the priorities. So this is a high level, oh, let me just take a drink. This is at a high level where we're pointing to what matters most or what we're hoping to achieve. Mm. Oh my gosh. Now I'm red as a tomato. After we identify those priorities, we're going to work on strategies, how we intend to meet the needs of those priorities, and then metrics.
Take your time, Jamila. Just, take your time. We're here. We're here. We're
Thank
here
you, thank
for
you, thank
you.
you.
So take your
Thank
time.
you. Could you go to the next slide?
Get some water, Jamila.
Thank you, thank you. Can someone read out loud the previous priorities?
Sure. So priorities for Healthier Together Oregon: institutional bias, adversity, trauma, and toxic stress, behavioral health, economic drivers of health, such as housing, transportation, and living wage jobs. And lastly, access to equitable preventive health care.
Thank you so much, Cecilia. So these were really innovative priorities when they were developed in partnership with community in 2018. And frankly, I'm proud of them. You know, I am proud of those priorities. And we have come quite a way in our journey. And we've heard that those priorities were really important, but challenging to accomplish. So we needed to be clear in actionable priorities and identify what we can do with resources available within public health. That transparency and realness of what we plan to do, and if given the resources, what we will do. So I'm here today to hear from y'all about what our new priorities should be. Next slide. And just to keep it so real, I wanted to share some of the realness around what the SHIP is and considerations that we are navigating with this work. So the public health division, so Oregon Health Authority, as y'all know, is like giant, right? It's like 5,000 people. And then we have the health division, the public health division, and that's the division that this team is on. And that's all of the programs that many of you get funding under. So what we do with this plan is we create this with community and with our staff. And then our public health division staff are the primary drivers and the primary folks doing the output of this work. So we can think housing is a fundamental health right and health need, and that can be out of scope for some of our work, period. So we can do that framing and that acknowledgement and partner with others and provide influence on other systems, the behavioral health system, the education system. But ultimately, the folks doing the day-to-day work on this are the public health division. And um, many of you might be involved with some of the LCHIPs, the local community health improvement planning work. One of the other parts of the power of the ship is that CCOs must choose two ship strategies to work on. Jasilia, will you read the next slide?
Of course. So, drafted priorities for community input include healthy environment, emergency preparedness and response, health across the lifespan, disease prevention and health promotion, physical, mental, community safety, mental well-being and behavioral health, and equitable social conditions.
So these look a little bit different from the previous priorities, and that's because we were taking into consideration that other information that I shared, focusing on clear priorities and work that we can accomplish. I'm going to go through and give some examples of what public health can do or might do within these different scopes. And my question is, what are some of your top priorities from this list? Or what else do you want us to know about or share with our steering committee? Because ultimately, our steering committee are going to be the folks who select these priorities in May. We're gathering your feedback, and they will be making decisions about these priorities in May. So first up, we have healthy environment. And what that looks like in public health is things like healthy fish consumption and how we use our programs and policies to support things like that. And many of you are familiar with the work of like healthy homes free of environmental hazards. A good example of this work is the air conditioning or heat pump work. Preventing heat and wildfire smoke-related illness, hospitalizations, or death. That's what we see as work we can do in the public health division under this banner. Next slide. And many of you are familiar with this body of work, emergency preparedness and response. In the public health division, this might be saying that we really prioritize state, local, and community organizations planning together and collaborating before emergencies happen, and communication practices and systems that include all community members and meet their communication styles and needs. Next slide. This one is a broad one, and you're going to notice some overlap in a lot of these, and we constructed that in this way intentionally. So when we were making our final selections, we would have broad coverage. This one we're calling Health Across the Lifespan. Jasilia, would you read this one? A couple of them.
No problem. So, for health across the lifespan, you have things like access to cultural relevant foods for women, infant, and children on WIC. You have access to routine immunizations and vaccines for childhood and adolescents and adults. You have fall prevention among older adults, and you have things like dental visits and screenings that fall in the health across the lifespan.
Perfect. And again, these are all in the scope of public health. Next up, we have disease prevention and health promotion. And that looks at things like the work y'all do of culturally tailored and specific disease prevention efforts and interventions. alcohol, tobacco, and other drug prevention or harm reduction, and access to immunizations and vaccines. Next slide. This topic, I'm going to be real, this absolutely came up because of community conversations and what we were hearing from different community groups where they highlighted the importance of safety, physical, mental, and community safety. And where we see ourselves as part of that is working to support things like neighborhoods with nice parks and safe spaces, especially looking at the training element and what training we can provide and support, especially about biases, trauma-informed care for social workers, police, public health workers, and community-specific programs that might prevent abuse and support people who've experienced abuse or trauma in culturally responsive or appropriate ways. And institutions and systems that are working to remove unfair treatment and treat everyone with dignity and respect. Next slide. Mental well-being and behavioral health. This is a complex and nuanced conversation. And this is where I acknowledge, broadly speaking, as a public health queen, public health claims everything. We claim everything. We see everything as public health. This peanut butter on my plate, public health. These sanitizers, public health. Everything's public health, including behavioral and mental health, right? Public health. But functionally speaking, in the systems that we are navigating and working on in this plan and in our organization, behavioral and mental health services, like having um, mental health providers that speak a variety of languages and are compensated by Medicaid and stuff like that, just so real, that is outside of the scope of public health. So that can both be really important, and I just want to practice that transparency and show you what we in public health, yeah, Medicaid is public health, and in our system, we as public health division do not make choices for Medicaid. Right? So we don't make choices for Medicaid. We do not direct the work of the behavioral health system in Oregon. So in this ship, however, we do things like we support people through mental and behavioral health in schools, at school-based health centers. We support folks through home visits with pregnant folks, infants, and young children, and connect them into services. We do, I mean, this is the work many of you do, which is you're doing a type of mental and behavioral and well-being help within community-specific engagement and education within the public health context, getting people connected into systems and things like suicide prevention. So this is a complicated, nuanced topic, and I just want to say public health has a role to play, and we are not the only ones doing this work. Next slide. And finally, many of you might be familiar with the term social determinants of health. Those are seen throughout every single priority, but it felt really important to explicitly acknowledge that there are equitable social conditions that impact or injustices that impact our health. And we, again, can't own and change all of these things, but we are called to think critically about how public health can work to support other programs and initiatives and uplift the acknowledgement that people's health status has more to do with systemic components than individual choices. So that's that priority. So I'd love to hear from you and give my vocal cords a little bit of a rest. What are some of the top priorities for you all from this list? And what else do you want us to know? You're welcome to share in chat. We also have a survey. The link is going to be on this later on this slide deck, but I would love to hear from you.
Do you have a list of all of the different
Yeah,
areas?
if you could go back like 8 slides. Here you go.
Thank you. Okay, I'm just going to read some stuff from the chat. Jamila says, I can see all these priorities cross-pollinating. For example, I see emergency preparedness, mental well-being, physical, mental community safety, health across lifespan, having common themes. Should we be ranking priorities based on the common denominators of this list?
This is Jamila, and honestly, it's up to you. Different community groups do it differently. I went to a tribal space where they were like, this is all really important. We're not ranking it. So really, up to you. I'm just here to get your vibe, get your insight.
Thank you, Jamila. So right now you're asking folks if they want to say out loud or just drop in the chat the priorities that most resonate for them.
Yeah.
And you're collecting that information from the chat and taking back with you.
The chat or out loud, or we do have a survey link later on in this presentation where folks can fill out the survey.
Okay. So some things that are popping up, Carissa says access to behavioral health, especially for people on Medicaid. And Jamila says, this is all important. I'm not ranking them. Amy Nash says, equitable social conditions require all of the others, in my opinion. Denise says, access to behavioral health, especially for youth, including those from marginalized demographics such as BIPOC, LGBTQIA+, and rural communities. Carrie would like to advocate for local sourcing of fresh fruits and vegetables as a foundation needed to support all of the listed priorities. So this is the first new addition. Karima says, agreed, this is all connected, related. They cannot be ranked. All of them are important. So too for having them all ranked equally. And Dr. Sandra has at Duelist Latinas, we do cross the different topics and prioritize population. We are serving pregnant mothers, youth, and adults. So Jamila, I'm just trying to be mindful of time, and wanting to have everyone who maybe needs more time to think about the list, maybe read through things, to give them that time to respond back. Do you want to share about the survey?
Absolutely. So we do have a survey that we will send out with the meeting materials. It will be open until May 2nd, and it's a really brief survey, y'all. I think it's like 4 or 5 questions. We're going to compile this information, share it with our steering committee, and they're going to make some choices about priorities. Thank you so much, and I hope to come back. Dulce or I hope to come back maybe in the summer or fall and share a little bit more about our progress and get your wisdom.
Thank you, Jamila. We will also be sending out the links for the survey in our follow-up. And there's also going to be some reference slides with acronyms, definitions, all that good stuff when we send out the slide deck as well. Any questions? Also contact Jamila. And we'll be going to announcements and upcoming CBO events. There's a few that y'all have already sent, but want to leave space at the end to be able to share anything that we haven't mentioned. So if we can go to the announcements and upcoming event slide. Thank you. All right. First up, share your tobacco prevention stories. The READ group is going to be collecting stories from the Oregon Tobacco Prevention and Education Program, also known as TPEP partners. So if you're funded for tobacco, that is you. Your stories will be included in the state tobacco prevention partners evaluation and can help shape future support for the work we do. And there is some compensation for your time. The flyer is on the slide. And there's also a QR code for more information and to say you're interested. Next slide, please. We have two events. One from Afro Village, the Afrofuturism Oasis on Earth Day. Does anyone from Afro Village want to talk about this event a little bit more?
Actually, echoes.
And then we also have
I don't see Laquita on today, but just to share a little bit more, they're doing an Earth Day event. It's going to be at their new Larrabee site, and it's going to just kind of launch this new work that they're doing in that space. That's going to be community for community. It's going to be really cool. We'll share more information with the follow-up so you can see it's an all-day event. So we'll send that information out. And it sounds like Sharif might be able to speak to the ICO event if no one from ICO is here.
Let me first give them the chance. I don't know who is here. Could they have these programs where they take kids back to East Africa, back and forth, with a lot of cultural educations. So if you want to attend, it's tomorrow, 2:30 to 5, PCC Cascade.
Thanks for sharing. Hopefully folks are going to be able to attend. And we do have a couple other ones. We have Ready, Set, Connect in Spanish and also Rockwood Center Community Care Day, also tomorrow. Does anyone from Upstream Access or Rockwood Center like to share a little bit more about these events?
This is Laura actually here for Aaron Taylor for Ready, Set, Connect, on the board of Upstream Access. And we are super excited to be doing our Ready, Set, Connect in Spanish. So this is an opportunity. We saw a huge need when we were doing our emergency preparedness for people with disabilities, also within the Spanish-speaking community. And so each month we have different topics and different speakers that come in. So we're super excited that we've expanded into the Spanish-speaking communities. And then we also have ASL interpreters there in all of our Ready, Set, Connect sessions. Thank you.
Thanks for sharing. And Dr. Sandra, I see your hand.
Yeah, Allison, hey, just want to say the Rockwood Center, I'm not involved directly in the Community Care Day, but as one of the board members, I would really recommend, because what we are looking at the Rockwood Center is to bring as much as possible the diverse and rich communities in Rockwood area where we are located. the Stark with 108 seconds. Come if you can.
Thank you both for sharing. We just have a couple left. We have the Health and Wellness Fair on April 26th with Community Services Network, the Rosewood Initiative, Community Coalition of Community Health Clinics, and it looks like some other partners too. So that is, anyone want to speak to this event? And Amina, I see your hand. Would you like to share about your event that you put in the chat?
Yes, hi, good afternoon, everybody. Thanks for having us. I just want to share this event. It was a long coming. As a lot of you guys, I'm not sure if you're aware of that. It is mental health event. We are having the two Somali Canadian girls that are flying from Toronto coming here. They travel around the world and they have a broadcast. And the reason why I chose those girls is that mental health is really taboo in our culture. It's not talked about it. And when you talk about mental health, people connect to that is like once you lose completely and you take your clothes and run into the streets. But there are so many layers of mental health that affect, especially women in our community, that it's not addressed. So we just want to take the stigma out of it and just let people know that this is normal. It's a stage that everybody go through it, and there are help that you can go ahead and get it. And I'm really excited, and I would love to share the registration event. We are aiming, I think, about 400 people. We already have more than 300 people registered, and would love anybody to join us. It will be Sunday the 27th, and I'll share the flyer.
Thank you for sharing. Shiloh has put in the chat, tomorrow is the LCC powwow. Do you want to share a little bit about that, Shiloh?
Yeah, hi everybody. This is Shyla West again from the Arco County. Yeah, we're having a powwow. It is an annual powwow every year at Lane Community College in the big gym. First session starts at 12 o'clock and it goes till 5, and then we break from 5 until 7, and then we have our second grand entry at 7 o'clock, and we'll go till about 10 o'clock. They like us to be out by 10, which usually lasts till about 11, but um if those of you that don't know what powwow is a celebration of our people gathering and basically saying we're still here as a people, and we share in our drums and our dancing, and we love everybody to come and be a part of it. We have categories where we have certain styles of dance, and then we have what's called intertribals, and intertribals are where we welcome the public to come in and join in the dancing. There is an MC that does a lot of announcing, so they explain each category. They explain when times to stand in honor of things, when there are times that it's okay to take pictures, times that's not. But it's really just something that I think everybody could really enjoy. And so I'd just love to invite you all to be there. And I'm sorry I'm off camera today.
Allison, you're muted.
Thank you. Carrie shared Oregon Nonprofit Leaders Conference. Registration closes on 4/7. Do you want to talk a little bit more about that?
Sure. We're not hosting this event. It's put on by Nonprofit Association of Oregon, but I am highly motivated to attend it and registered for the first time due to all my interactions with Leslie Bennett. And I've never been so excited to attend a bunch of fiscal workshops before. So looking forward to learning more. I also included the Jackson and Josephine County Health Fair. The registration date for vendors has passed, but I think you could probably still get in if you wanted to vend, and it's free attendance to the public. And that will be held in Medford. That's being put on by All Care Health.
Thank you for sharing.
Sure.
And Sandra, I see in the chat for the Earth Day and Reproductive Justice Second Conference. And I also see your hand. You want to talk about that a little bit?
Yeah, well, that's the information there, but I want to invite everyone. It's for free, some food, really children and adults activities in our vegetable garden, environmental education, water contamination, and all the issues of pesticides. Anyways, and really we are looking to have, a mix of people, Spanish, English, Man, and Kanhabal will be offered. And that is June 19th, Saturday. So beautiful day, we hope. If not, we also be inside, so we have space for everything. Come and join us. And there is an email there to register. Thank you. Oh, Carrie, I'm planning to be there too. Let's meet.
Thank you for sharing. We are at time, but we have two more in the chat. If you can hang on for just like 2 more minutes. If you don't, that's totally fine. But we just have two more things in the chat that folks are wanting to announce. Teresa, do you want to talk about what you put in the chat?
Yeah, hi everybody. I'm Teresa with Northeast Oregon Network, and my office is in La Grande, Oregon. And we are going to be collaborating with our Center for Human Development to bring together a family resource event and children's celebration. It's going to be next Friday, April 11th, at the Center for Human Development in La Grande, Oregon, from 3 to 6. We're going to have kids' activities, resources. Organizations are going to be tabling information and resources, and we're going to have just different kid activities. I think each table is going to be providing some kind of activity for kids to do. And Allison, I just sent you the flyer.
Great, thank you. I just have one more from Jamila for those in Washington County. Do you want to talk a little bit more about that, Jamila?
This is Jamila, and this is just something I volunteer with. We do really fun hands-on STEAM activities with kiddos. It's completely free. Um, the last one I did was I was the English facilitator, and every single session had a Arabic facilitator. So we did English and Arabic, and we also do English and Spanish. It's volunteer run with United Way. So if you have a 3 to 5 year old, definitely check it out. It's a lot of fun.
Thanks for sharing. And I think that's it for today. Thanks everyone for attending. Hope you have a wonderful weekend. Enjoy the sun and take care. See you next time.
Bye, everybody.
Ciao, everyone.